My name is Debbie Strickland.
Deborah Godwin.
Alfredia McClellan.
In June of 2004, I was diagnosed with breast cancer on my left breast.
It was April 2016. I was just found a lump on my right breast.
I did a self-examination on April 1st, 2019. And I knew that knot on the right side of my breast was abnormal. So I knew I had to find a doctor to make sure.
And then ended up doing the surgery here in Lumberton at Southeastern, lumpectomy. Once I finished my healing process, then I went through 5 rounds of chemotherapy. And then after the chemotherapy, I went with 35 rounds of radiation treatments at Gibson Cancer Center.
Called my OB/GYN doctor, which is Dr. Williams, and she wanted to send me for an ultrasound and a mammogram. So I came over to Southeastern Radiology and I got my mammogram done. I talked to the radiologist and he suggested that I have a biopsy. And they did confirm that it was breast cancer. So I did 9 rounds of chemotherapy and 27 rounds of radiation. October of 2016 is when I had my surgery for the removal of the breast. So, and then after that, that's when I started my radiation.
I just finished my first round of chemo. It was really not good because I got sick because the medication did not agree with my body. So I had to stay in the hospital for 7 days. What they had to do is split up my treatments. So I'll start my second round next Thursday, and I will have chemo for the HER2 positive part of my cancer, and then I'll have surgery.
You know, it was really tough during that period of time, but my experience at Gibson Cancer Center made it a lot easier. And when I say that, because the nurses and the doctors were so good, and it made it a lot easier on you once you were there and one of their patients and they were working with you and going through the chemo. And once I finished my chemo, yay, I was so glad. It was like, let's have a party, I'm through.
Gibson, for me, was awesome. The staff was very, very caring. They were wonderful. If I come in and I was having a bad day, like I just did not feel like I was going to be able to do something that day, they were there to encourage me, and it was wonderful.
My experience at Gibson Cancer Center has been wonderful. The nurses, the doctors, even the front desk people, they're just wonderful because they're friendly. They take time to give you their bedside manner stories, and I just love it. They take time for you.
It's life-changing. It is. It changes your life. It changes your look on everything. But I couldn't ask for any better people to take care of me than Gibson Cancer Center.
If anyone else is going through this, remember, you find a good support group. It may be your church family, it may be your own family. Let someone else share their story with you, what they've been through, and it makes it so much easier in your mind. Your body doesn't feel like it's any easier, but in your mind, it's just a peace knowing that, you know, I can get through this. I can do this because I've got my family and I've got my church family and I got all these folks cheering for me.
I would just like to kind of let everyone know, especially our ladies here in Robeson County, it's very important that you have your screenings done, your mammograms, whatever it takes to kind of keep up with making sure you're okay, because that is very important in finding what's the troubles in our ladies. And not just ladies, we've had men also that's been diagnosed with breast cancer. So it's very important that you just stay on that each and every year. If you can get it every year, do your screenings. Do go to your doctor. Take care of yourself, because you got to take care of yourself. That's the only way you can make it, is take care of yourself.
My slogan each day is cancel cancer. We have to cancel cancer. As long as God is for us, who can be against us?